I'm going to show you my setup, my sharps container. Alright, so the first thing I do when I walk in the medication room, I am going to close the door behind me, avoid any interruptions, limit conversation, do not answer phone calls, follow the hospital policy for the no interruption zone. So the next thing I'm going to do is compare the patient care order form to the MAR. So we have our patient, Jaguar J. Jones, date of birth 8/25/63, MR number 4176352, MR number 4176352 with an allergy to penicillin, So that's our patient. Next is going to be the medication. We have Novolin R, regular insulin, U100 insulin, Novolin R, regular insulin, U100 insulin. Our dose is going to be 10 units, and this is something we verify with another nurse. Our route is going to be subcutaneously, and for the insulin we're going to be injecting in the abdomen today, and I'll go over that in my next video where the landmarks are. The time is going to be 30 minutes before meals. The indication is going to be following a blood glucose test, and this has all the elements of a legal prescription. So I'm going to put this patient care order form to the side, and then I would do hand hygiene. So all I'm left with is the MAR. So we're going to begin our first check. So we have our patient, Jaguar J. Jones, date of birth 8/25/63, MR number 4176352 with an allergy to penicillin. We're going to get our medication, our Novolin R, regular insulin, U100, with an expiration date of 12/1/25. So Novolin R, regular insulin, U100 insulin, and here it is. So we have our medication. The next is going to be the dose. We have 10 units, and this is something that you would verify with another nurse. Our route is going to be subcutaneously, so we have to select the correct syringe and needle. So we have our 29 gauge, half in length, insulin safety syringe. So we have our route. The time is going to be 30 minutes before meals, and the vial states 8 a.m. right here, so it's going to be 30 minutes before meal time. The indication is going to be following a blood glucose test, and documentation, we have all the elements of a legal prescription. So the next thing I'm going to do is draw up the medication. First we have to clean the vial. I'm going to put it right here so you can see. Making sure not to contaminate. And we're going to pull back 10 units of air. And we are going to push that air in and pull back 10 units. So I would check this 10 units, and I would verify with another nurse. There we go. So we're gonna do our 7 rights again. So we have our patient, Jaguar J. Jones, date of birth 8/25/63, MR number 4176352 with an allergy to penicillin. We have, so that was our patient. We have our medication, Novolin R, regular insulin, U100. Novolin R, regular insulin, U100 insulin. We have our 10 units, 10 units. This is something you would check with another nurse. The route is going to be subcutaneously, and this is a subcutaneous syringe needle. And we're going to be doing it in the abdomen, which I'll go over in the next video where the landmarks are. The time is going to be 30 minutes before meals, and this file states 8 a.m. on it, so that's going to be 30 minutes before meal time. The indication is going to be following a blood glucose test, and the documentation, this has all the elements of a legal prescription. So the next thing we're going to do is put on the label. And the label just includes the patient's name, the medication, and the dose. So we have Jaguar J. Jones, Novolin R, U100 insulin, 10 units. So now we're going to move down to the patient's room, bringing the MAR, the vial, and the syringe. I'm going to take this down with me. So when I enter the patient, well, I have my patient's wristband right here and the MAR, and then I have my sharps container. So the first thing I do when I enter the patient's room is I'm going to do hand hygiene. I'm going to raise the bed to a working height and lower the side rail. I'm going to explain to our patient that we are giving him his insulin. And I'm going to identify the patient using at least 2 identifiers. So we have Jaguar J. Jones, Jaguar J. Jones, date of birth 8/25/63, 8/25/63, MR number 4176352, MR number 4176352 with an allergy to penicillin, and then I would verify with the patient and make sure that he has no more allergies to make sure that we just have it all documented. And now would be the time where I test the patient's blood glucose. So now I'm going to continue my 7 rights. So I have the patient. Now we have our medication, the Novolin R, regular insulin, U100. Novolin R, regular insulin, U100. We have our dose, which is 10 units, 10 units. Our route, which is subcutaneously, with our subcutaneous needle syringe. Our time is going to be 30 minutes before meals, and this is 8 a.m., so that's going to be 30 minutes before mealtime. Our indication is following that blood glucose test, and documentation, this has all the elements of a legal prescription. So the next thing I'm going to do is put on my clean gloves. So before we give the injection, we're gonna observe the integrity of the skin and make sure there is no bruising. Next we are going to clean, going in an outward motion, making sure not to contaminate. So for this injection, you pinch, insert, release, and inject, and it's going to be at a 90-degree angle because we can pinch 2 inches. I'm going to do it where you can see it. So pinch, inject, release, and inject. I'm going to say insert instead of inject, but there we go. And we're going to throw this into our sharps container and apply a gentle pressure. From there, we are going to do hand hygiene after removing our gloves, And then we are going to document that we did give this medication, and we're going to document how the patient handled the procedure, and well, before all that, we would lower the bed, put up the rail, and then we would remove our gloves and do hand hygiene. And once we've given this injection, we would monitor the patient and make sure that they handled it okay. Yes, I think I covered it all.